Good morning, everyone. I'm Dr. Mark, and you're watching Dr. Mark Official. Today, I want to talk about something many people don't think about until it becomes a problem: our nerves. Nerves are like the body's electrical wiring. They help us feel temperature, pain, touch, and vibration. They also control movement, balance, and many automatic functions we rely on every day. When nerves are damaged, the result can be neuropathy, often felt as tingling, burning, numbness, weakness, or sharp shooting pain, usually in the hands or feet. The good news is that nerve health is not completely out of our control. There is one vitamin that plays a powerful role in protecting nerves and supporting repair. So much so that when it's low, neuropathy-like symptoms can appear, and when it's restored, symptoms may improve for many people. That vitamin is vitamin B12. Vitamin B12 is a key nutrient for nerve protection because it supports both the structure of nerves and the body systems that keep nerve tissue nourished and able to repair itself. One of its most important jobs is helping the body build and maintain the myelin sheath. Myelin is a fatty, protective layer that surrounds many nerves, acting like insulation around an electrical wire. Its purpose is to keep nerve impulses strong and efficient as they travel from the brain and spinal cord to the rest of the body and back again. When myelin is intact, signals move quickly and accurately, allowing normal sensation, steady balance, and smooth muscle control. If myelin becomes damaged or thins out, the electrical signal can slow down, leak, or short circuit. That's when people may notice symptoms such as tingling, numbness, burning sensations, or sudden stabbing pains. They may also feel clumsy, unsteady, or weak because the messages that coordinate movement are no longer being delivered with the same precision. B12 supports myelin through its role in critical chemical reactions in the nervous system. It helps the body run processes involved in fatty acid and phospholipid metabolism, important building blocks for maintaining nerve membranes and myelin integrity. It also participates in the methylation cycle, a set of reactions that helps regulate and maintain nervous system function. When B12 is low, these processes can be disrupted, and over time, the nervous system may become more vulnerable to damage. This is one reason B12 deficiency can produce nerve-related symptoms even in people who otherwise seem healthy. The nerves, especially the longest ones that extend into the feet and hands, are often the first to show problems because they have the greatest distance to maintain and rely heavily on consistent support and repair. The second major reason B12 matters is that it supports the production of healthy red blood cells and helps maintain normal DNA synthesis and cell repair. Red blood cells are responsible for carrying oxygen throughout the body. Nerve tissue is highly active and requires a steady supply of oxygen and nutrients to function properly. If B12 is deficient, red blood cells can become abnormal and less effective, and overall oxygen delivery may be reduced. Even mild decreases in oxygen and nutrient supply can affect nerves because they are sensitive tissue with high energy demands. Over time, poor delivery can contribute to nerve irritation, slower recovery after stress or injury, and worsening symptoms like burning pain or reduced sensation. Beyond oxygen delivery, B12 is essential for making and repairing DNA, which affects how cells renew and maintain themselves. While mature nerve cells have limited ability to regenerate, supporting cells around nerves and the tissues that maintain nerve pathways still rely on effective repair mechanisms. When B12 is too low, the body's ability to keep up with routine maintenance can slow down. That can mean damage accumulates more easily, inflammation may have a greater impact, and recovery from everyday wear and tear becomes less efficient. In practical terms, this is why B12 deficiency can gradually progress from occasional tingling to more constant numbness or pain if it isn't addressed. It also explains why restoring B12 can help some people improve, especially when deficiency is identified early, because the body regains the materials it needs to stabilize myelin, support nerve signaling, and strengthen the overall environment that nerves depend on. How low B12 can look like neuropathy. Low vitamin B12 can mimic neuropathy because the nervous system depends on B12 to keep nerve signaling smooth and protective nerve covering intact. When B12 levels drop, symptoms often begin subtly and may come and go, which is why many people dismiss them at first. A common early sign is tingling, often described as pins and needles in the toes, feet, or fingertips. It may feel like a mild buzzing, a crawling sensation under the skin, or a light prickling that's more noticeable at night or when sitting still. Because the longest nerves in the body travel to the feet first, sensations frequently start there and may slowly move upward toward the ankles or calves if the deficiency continues. As the problem progresses, tingling can shift into numbness or reduced sensation. People may notice that their feet feel thick, as if they're wearing socks when they aren't, or that the floor feels different under their feet. Some may realize they're less able to tell hot from cold or sharp from dull, which can increase the risk of burns or unnoticed injuries. This loss of sensation can be especially concerning warning because it affects protective feedback, your body's ability to warn you that something is damaging your skin or joints. Another neuropathy-like feature of B12 deficiency is burning pain or hypersensitivity. Instead of decreased feelings, some people experience the opposite. Normal touch becomes uncomfortable, light fabric feels irritating, or a gentle squeeze feels sharper than it should. Burning can be constant or flare in waves, sometimes described as heat, electric shocks, or stabbing pains. These symptoms can be confusing because they may appear without any visible redness or swelling, making it hard to explain to others and easy to misattribute to circulation problems, aging, or sleeping wrong. B12-related nerve issues can also affect movement. Muscle weakness may show up as trouble climbing stairs, getting up from a chair, gripping objects, or doing tasks that require fine coordination. People might drop items more often, feel their legs give out, or notice cramping and heaviness. Poor coordination can look like clumsiness, bumping into furniture, misjudging steps, or struggling with buttons and handwriting. This happens because nerves don't just carry sensation, they also carry signals that control muscles and reflexes. Balance problems are another important clue. When nerves in the feet aren't providing accurate feedback about pressure and position, the brain receives incomplete information about where the body is in space. Someone might feel unsteady in the dark, on uneven ground, or when turning quickly. They may walk with a wider stance without realizing it, or rely more heavily on handrails. These balance changes can increase fall risk, particularly in older adults, and may be mistaken for inner ear issues or general weakness. B12 deficiency can also bring broader symptoms that accompany nerve complaints. Fatigue is common, sometimes profound, because B12 supports normal blood cell production and energy metabolism. Brain fog, slowed thinking, forgetfulness, irritability, or low mood can occur as well, since the brain and nervous system are highly sensitive to nutritional shortages. Some people find they can't concentrate like they used to, lose their train of thought, or feel mentally dull, which can be frustrating and anxiety-provoking. What makes all of this especially important is the time factor. When B12 deficiency persists, nerve damage can gradually become more established and may not fully reverse, even after levels are corrected. Early symptoms are more likely to improve, while long-standing numbness and balance problems can take much longer to recover and may remain partly permanent. That's why ongoing tingling, numbness, burning pain, or unexplained balance changes shouldn't be ignored. Checking B12 status early can be a simple step that prevents more lasting nerve injury. Who is at risk of low B12? Vitamin B12 deficiency risk comes down to two main issues: not getting enough B12 into the body through food, or not being able to absorb what you do eat. Unlike some nutrients that the body can absorb easily, B12 absorption is a multi-step process. In the stomach, acid and enzymes help release B12 from food proteins. Then B12 must bind to intrinsic factor, a special protein made by the stomach lining, and finally it's absorbed in the last part of the small intestine, the ileum. If any part of that chain is weakened, B12 levels can slowly drop over time, sometimes without obvious warning signs early on. Adults over 50 are at higher risk largely because stomach acid tends to decrease with age. Lower acid makes it harder to free B12 from food, especially from meat and dairy where it's bound to protein. Many older adults also develop chronic gastritis or changes in the stomach lining that further reduce acid and intrinsic factor production. This means someone can be eating B12-containing foods regularly and still absorb less than they need. Because the body stores B12 in the liver, the decline may happen slowly, making it easy to miss until symptoms such as numbness, tingling, or fatigue become persistent. People who eat little or no animal products are at increased risk because B12 is naturally found almost exclusively in animal-based foods like fish, meat, eggs, and dairy. Plant foods do not reliably provide active B12 unless they are fortified. Some people assume certain algae or fermented foods provide enough, but these sources are inconsistent and may contain inactive B12-like compounds that do not meet human needs. For vegetarians, intake may be borderline if dairy and eggs are limited. For vegans, risk rises significantly unless they routinely consume fortified foods or take a dependable supplement. This is especially important for pregnant people, breastfeeding parents, and children on plant-based diets because B12 is crucial for brain and nerve development. Digestive conditions are another major risk category. Problems can occur in the stomach, where intrinsic factor is made, or in the small intestine, where absorption happens. Pernicious anemia is a well-known cause. It's an autoimmune condition that attacks the cells responsible for intrinsic factor, drastically reducing absorption. Celiac disease can damage the intestinal lining and interfere with nutrient uptake. Crohn's disease can affect the ileum directly, making B12 absorption difficult. Surgeries that remove or bypass parts of the stomach or small intestine, such as gastric bypass procedures, can also reduce absorption long-term, often requiring lifelong monitoring and supplementation. Certain medications can contribute as well, especially when taken for long periods. Acid-reducing medicines such as proton pump inhibitors and H2 blockers can lower stomach acid enough to interfere with B12 release from food. Over time, that can translate into declining B12 stores. Another commonly used medication, metformin, can reduce B12 absorption through effects on the intestine, and the risk increases with duration of use. People taking these medications may feel fine for years, so B12 status can be overlooked unless it's checked. Finally, people with unexplained anemia or persistent fatigue belong on the higher risk list because B12 plays a key role in making healthy red blood cells and supporting energy metabolism. Deficiency can lead to larger abnormal red blood cells and reduced oxygen delivery, causing tiredness, weakness, and shortness of breath. However, not everyone develops classic anemia right away. Some experience neurological symptoms first. That's why ongoing fatigue, pale skin, dizziness, brain fog, or nerve symptoms without a clear cause should prompt consideration of B12 as a possible factor, even if diet seems normal. How to support healthy B12 levels. Maintaining healthy vitamin B12 levels is usually achievable with a combination of smart food choices, awareness of absorption issues, and timely testing when symptoms appear. Because the body can store B12 for a long time, people often assume they are fine, but levels can slowly decline, especially when diet changes, digestion weakens, or certain medications are used long-term. Supporting B12 status works best when it's approached proactively rather than waiting until nerve symptoms or extreme fatigue develop. One of the most practical steps is regularly eating B12-rich foods. Natural B12 is found primarily in animal-based products, so including fish and seafood, meat and poultry, eggs and dairy can help meet daily needs. Fish such as salmon, tuna, sardines, and trout are particularly useful sources and also provide protein and healthy fats. Meat and poultry can be reliable sources as well, though the amount varies by type and portion size. Eggs provide B12 in the yolk, and dairy foods like milk, yogurt, and cheese can contribute steadily, which is helpful for people who don't eat much meat. For those who don't consume animal foods, fortified products become important. Many breakfast cereals, nutritional yeasts, and plant-based milks are fortified with B12, but the key is consistency and label checking. Fortification levels vary, and some products don't contain B12 at all. Using fortified foods daily can help, but it requires paying attention to serving sizes and how much B12 is actually provided per serving. Food intake alone isn't always enough, especially if absorption is reduced. That's where supplements can be useful. People who follow vegetarian or vegan diets, adults over 50, and individuals with digestive conditions often benefit from supplementation because the body may not extract B12 efficiently from food. Supplements are available in several forms. Standard oral tablets are common and work well for many people, particularly at doses that account for lower absorption. Sublingual forms, dissolved under the tongue, are popular, though for most people they are not proven to be dramatically superior to swallowing a tablet. The main advantage is convenience for those who have trouble swallowing pills. In cases of significant deficiency or conditions that severely limit absorption, such as pernicious anemia or after certain gastrointestinal surgeries, clinicians may recommend injections or high-dose oral therapy under supervision. The right approach depends on the cause of low B12, symptom severity, and lab results, so it's wise to match the method to the individual situation rather than guessing. Testing is another major part of protecting B12 health, especially when symptoms suggest a possible deficiency. Ongoing tingling, numbness, burning pain in the feet or hands, balance changes, unusual weakness, or persistent fatigue should not be brushed off as normal stress or aging. A simple blood test can measure serum B12, but sometimes that number alone doesn't tell the full story. If results are borderline or symptoms are strong, additional tests such as methylmalonic acid, MMA, and homocysteine may be used to confirm whether the body's tissues are actually lacking B12. A complete blood count can also reveal anemia patterns sometimes linked to deficiency. Testing matters because nerve-related B12 deficiency is time-sensitive. The earlier it's identified, the better the chance of symptom improvement. Waiting too long can allow nerve damage to become harder to reverse. In day-to-day life, supporting healthy B12 levels also means being mindful of risk factors. If someone takes acid-reducing medications or metformin long-term, it's reasonable to discuss periodic B12 monitoring with a healthcare professional. If a person has digestive issues like celiac disease, Crohn's disease, chronic gastritis, or has had bariatric surgery, B12 should be treated as a routine nutritional checkpoint, not an afterthought. Combining a dependable dietary source, supplementation when appropriate, and timely testing when symptoms appear is the most realistic way to maintain steady B12 levels and protect long-term nerve health. Important reminder, neuropathy has many causes. It's also crucial to be honest honest, not all neuropathy is caused by low B12. Neuropathy can be linked to blood sugar issues, injuries, autoimmune problems, thyroid disorders, infections, toxins, and more. So while B12 is a key vitamin for nerve protection, it's not a one-size-fits-all answer. But because B12 deficiency is both common and treatable, it's one of the most important factors to check when nerve symptoms appear. To sum it up, if we're talking about a vitamin that protects nerves and can help prevent neuropathy related to deficiency, vitamin B12 stands out. It supports the nerve's protective covering, helps the body repair tissue, and plays a central role in how well our nervous system functions. Taking nerve symptoms seriously, nourishing the body properly, and checking B12 status when needed can make a real difference. Because protecting our nerves means protecting our movement, our balance, our comfort, and our quality of life. If you enjoyed this, like, subscribe, and comment your thoughts. Stay healthy, stay curious, and see you next video.